He's also said there are parts that he likes.
Right.
I do not totally believe, especially because he has Levitt as his transition team, I do not totally believe that he is against the exchanges. I would be surprised if he doesn't say this is one way to keep a market in America. And so I am not trusting Governor Romney, and this is one of the reasons that I say, even if he gets elected, it's up to the states to say no. The real power is in the states. Now, I wanted to say something about your pre-existing conditions because people don't understand this, and a lot of people really like the idea of covering people with pre-existing conditions. But here's what I want to say. I want to say that having a ban on pre-existing condition exclusions, saying that an insurance company has to cover people with pre-existing conditions, is an evisceration of health insurance, and it is a nationalization of health care. And it is so easily sold to the American public because it seems charitable and it seems compassionate. But the fact of the matter is there are other ways that pre-existing conditions could be dealt with. But if we accept that, if we accept even that one thing and we got rid of all the rest of Obamacare, then we will have a national healthcare system because insurance companies will no longer be insurance companies. They will be third-party payers of healthcare, and they will be mandated by the government.
Thank you. It changes the culture of insurance.
It certainly
right?
does.
So
That's
you're saying then Romney is not necessarily opposed to what you're trying to do, but he's not on record in favor of, so people should work at the state level in order to get that support. And maybe a lot of states would get the governor to realize that's where he should be.
I hope. I'm not so sure.
Thank you for your presentation. If a state were to enact legislation to prohibit an exchange in their state, I have to believe the federal government will penalize that state in some dire fashion. What will be the penalty for the state in doing so?
Well, I think that the penalty, given what happened with the U.S. Supreme Court, and I just want to tell you, I happened to be sitting in the U.S. Supreme Court when the decision came down, one of the last 8 people to get in. It was fun and unsettling all at the same time. But I have to believe that one of the things that the U.S. Supreme Court did was say with Medicaid that the federal government could not take away the Medicaid dollars for if a state refused to go forward with expanding Medicaid. The clear way and the clear intention of expanding Medicaid is putting in the exchange, forcing everybody to go there, forcing them to say what their income is, and then forcing them into Medicaid. So I think that one of the things the Supreme Court did was it protected the states against saying no to an exchange. I think their penalty is they don't get the millions and millions of dollars that are out there to build the exchange, but that is not much of a penalty when you consider that you're going to save freedom in healthcare by saying no.
Thank you for your presentation. You said that 13 states have accepted or have enacted exchanges. How many states does it take to not adopt the exchanges to wipe out Obamacare?
Now that's an interesting question. I feel like because the expense of the exchange is so horrendous, and because all the money for the exchange goes away on January 1st, 2015, and therefore the state must spend their own money to operate it, and it will be difficult for the federal government to be able to fund an exchange for just 13 states. And just so you know, those 13 states, they may have enacted partial legislation or full, but they are nowhere near actually putting one in for the most part. So, you know, it becomes something that we don't actually know the answer to, but if the majority of states say no, it's going to be very hard for the federal government to get control of the whole system.
So how many states? 10, 15, 20, 40?
Well, 13 states right now are moving forward, but they haven't got all of it into place. So the federal government is so nervous that they are trying to set up this federally facilitated and try and get the states to pay them a fee to run it because they don't have their own money. And 13 states aren't going to be enough to pay the fee to run it.
So if 25 states don't enact, it'll be very difficult?
It'll be beautiful.
I'm from Utah. And the legislator who pushed the exchanges in Utah was the Speaker of the House. He had so many mad at him afterwards that when he ran for Speaker, he lost. And then he felt so good about himself after that he decided to run for Congress. He didn't even make a dent, and he thought he was a pretty powerful person. And his big thing has been the exchanges. But one other thing I wanted to mention about Mike Leavitt. Many years ago, Mike Leavitt had another harebrained idea, and it was called Conference of the States. And he took on Phyllis Schlafly. And when it was over and he lost what seemed to be a slam dunk thing, he asked me if he could talk to Phyllis Schlafly. So she happened to come to Utah, and she sat down and talked to him, and he said, he even admitted to Phyllis, he says, I had no idea. He had no idea what he had run into when he thought what he was doing was such a great idea. In fact, he handed Phyllis another harebrained idea and asked her to take it and read it. I think it's like 28-page paper. And he said, I don't want to do this. I don't want to move forward with this unless you support me. Because he says, I'll never take on eagle form again. And of course, she didn't support it. So maybe that's the answer. Phyllis Schlafly and Mike Leavitt again.
I think that's a great idea. Okay, I want to just say one thing about Michael Leavitt. Michael Leavitt has been one of the key proponents in building a national health information network, a national medical record system, and that national medical record system called the NHIN is moving to combine with the health insurance exchange into creating this system to share all this data. So if you have an opportunity in your state to require patient consent before their medical records are put on a state health information exchange, you should do it. It's the only way you can control what happens with your doctors in the exam room, and it's the only way that you can stop rationing of care. 2.2 million entities will have access to your medical records without your consent once they're on the NHIN.